It's always fascinating to hear both sides of the same story, and it sounds like in your initial consultation that the pros and cons, the risk benefits, the options were quite thoroughly discussed with you. Dr. Marshall, welcome to Cure Connections.
Thank you.
What can patients expect from you in an initial consultation?
Yeah, so very often, almost always in fact, patients have seen a variety of other physicians before they get to us. They've talked to family, they've looked on the internet, they've talked to friends. And so they have a mindset that I'm not going to take any chemotherapy. They come in with an idea, a thought.
What we call doctor shopping.
That's exactly right. And so I think really the oncologist's job is to do just what we did, is to kind of set the stage. So here's what they've found, here's what it means, here's what we can do, here's what we can't do, here are the consequences of those pros and cons.
To consolidate the information.
Yeah, bring it all together and clarify. And it's very interesting to watch the transformation. It's one of the joys of our job, in fact, is to watch someone who's heard a bunch of different pieces and trying to put that all together in a storyline for them.
Make sense of the madness.
Yeah, and if you've done your job well, they leave with a very clear understanding and a decision, which is why we often push that decision back to the patient, because there's not necessarily clear yes and no answers here. I do want to emphasize the sort of team sport that is GI cancers, in particular colon cancer. I mean, you need gastroenterology, radiology, outstanding surgery, oncology, interventional radiology. We think about surgeons and oncologists, but there are a bunch of folks that support us behind the scenes to make us look good and to give us all that data and information. And so it's that team sport that we really bring forward.
Which applies to many cancers, not just GI cancers. And obviously there's a wealth of information to discuss with diagnosis, with treatment options, with discussing the procedures, the process, the side effects, and of course to explain to patients what the outcome will be. This is not a 2-minute conversation, is it? How do you get all the relevant information delivered to a patient who I'm sure is not taking in everything that's being said? It's a very emotionally charged situation. How do you communicate the right information without overwhelming the patient and yet answer and address all the relevant issues?
It is not a 2-minute visit, that's correct. So most oncologists would, just from a mechanics perspective, would book an hour, hour and a half for a new patient visit. The oncologist would typically have, before we even walk in the room, the pathology report, the surgical report, the gastroenterology report, scans, laboratory studies. And so we go in the room knowing pretty much the story, at least on paper. And so at least from my perspective, what I want to then know is, well, what's the story on the street?
Right.
You know, how is the patient? What's the patient bringing to this side of the formula? What is the support that's there? How has the recovery been? You know, where are you in your head and other physical issues? And try to integrate those. And I'll be frank, part of our job is to judge the desire to know detail. So some patients want to know every detail. Others just tell me what to do, kind of approach. Some people have done a lot of research and actually are pretty savvy. Others need educating as we go. So you use the time that you have to get patients through all of that to a place where hopefully at the end of that first visit, or at least in preparation for a second, that a decision can be made.
Now, you're an oncologist, and for many patients, just hearing that word oncology is a scary word. Certainly 20 years ago, many patients, when they were under a surgeon like myself, and we say, you know, I think it's time for you to see an oncologist, was a way of communicating to the patient that things were not looking good and that we were moving to more advanced disease. And yet, we're in a very different situation now with oncology, that often going to an oncologist means that the future's bright. We have many more tools in our toolbox to help patients. Do you still find that when you meet with that patient for the very first time, that there's a little bit of defensive body language that, you know, I don't really want to talk to an oncologist because I'm in the fighting mode and I'm not end of life? How difficult is that to get around?
Shoot, I go to a cocktail party and tell people I'm an oncologist, and they sort of pull back. So I do think it's a different world today. I think there are many patients who don't understand the various roles. It's like watching a football game or hearing somebody call a football game and you don't really understand what a wide receiver is and a quarterback is. It's very hard to understand the game.
It's a new language.
So it's a totally new language, a totally new team and world that you get involved in. So many times people will show up not understanding what my role is. So we start even at that very basic level.
Right.
Yeah, there's no question that cancer diagnosis in general is scary, and we, of course, represent that the most. I would say colorectal surgeon does too, but we all represent that feeling and fear and the like. So we've got to address that head on, and again, acknowledging that anxiety and the uncertainty with information almost always lowers that anxiety. So people don't really know what they're about to hear. And almost always what we say is better or worse than they were thinking.
Right.
And so setting that straight is a very important part of our role.